Canadians, like so many around the world, have been living through a pandemic for over a year, and many have experienced changes to both lifestyle and body. An American study published in the JAMA Network Open Medical Journal found participants, on average, gained 1.8 pounds per month when the United States initially introduced stay-at-home orders in March and April 2020. With the added stresses and negative emotions brought on by COVID-19 and more time spent sedentary, experts say they are not surprised to see bodily changes like weight gain and neck and back pain. Oshawa, Ontario resident Arfa Gain is one of many Canadians whose lifestyle shift over the past year of COVID-19 has changed her health.
And that's happened over the last year where I've kind of put my health aside rather than it remaining on the forefront.
Naturopathic physician Olivia Marie says the pandemic has triggered the body's fight or flight response for many people because they don't feel safe, which can lead to weight gain.
Because what happens is when we are stuck in a fight or flight response, we have this wonderful hormone called cortisol, which basically goes up. And when our cortisol goes up, we are going to hold on to weight and store weight because we're basically saving it from a rainy day.
Many people turn to food to cope during lockdowns when feeling stressed or lonely. So often, eating is something people feel is within their control and is often associated with celebration or a reward.
Because when we're having the cookies, the cakes, whatever we're, indulging in to give that emotional response, it actually triggers that dopamine hit in the brain that we're no longer getting. Maybe we've lost our jobs, and so we're not getting the dopamine hit there, or we're not getting it from, being around friends and family because now we're isolated.
But it's not just weight gain that has changed people's bodies. According to physiotherapist Matthew Lang, he's seeing more clients in his practice suffering from neck and back pain since the pandemic began as people shifted to working from home, which is increasingly impacting a younger demographic than he's seen before.
I risk saying it's because of lack of mobility, but there's definitely some correlation between the lack of movement we're just doing in our day-to-day lives. And when I say younger, that 20 to 35-year-old group, just spending more time between phone and laptops, bad setups at work, and continually being on your phone or your tablet all day has definitely contributed to seeing a lot younger patients than we used to.
Lang also says he's had patients report feeling they're missing their 10-minute walk to work or moving around the office to speak with someone in another cubicle, an experience that has been lost with the work-from-home lifestyle and replaced by video or phone calls.
You can't meet somebody for coffee. You can't meet at a bar or for lunch to catch up with somebody. So more and more of our life is driven into a small device, which unfortunately, again, puts us in a non-optimal kind of body position. And it's not to say, being on the couch curled up, swiping through your phone is bad, but to be doing that for 8 to 10 hours a day, that's the problem.
With these emerging and increasingly common changes, Canadians might be wondering what they can do going forward, including Winnipeg resident Ben Savage.
I think it would be helpful if public health officials, for example, created, let's say, guides on dealing with the mental health effects of the pandemic, the physical health effects of the pandemic, not just for those that unfortunately got COVID-19, but those who are dealing with the effects of the pandemic.
Experts say a good starting point is to take an introspective look into your mood. How does the situation make you feel and why? Olivia Marie suggests taking the time to do activities that bring you joy, such as virtual gatherings or walks outside, and not being afraid to seek professional help to deal with core issues.
It's important to you to feel emotions. So a lot of the time, if you are reaching to food or you're reaching to whatever else to push it down, you push it down for 30 minutes or an hour or that night. But that loneliness or that, fear of being alone or that sadness, that anxiety, it's going to keep creeping up until you actually get to the root of why are you feeling anxious? Why are you feeling sad and feeling that? Because all those other things, they're Band-Aids.
And for neck and back problems, try to find bite-sized pieces of activity during the day.
So with some of my clients, we try to find activities they can do, between or while they're cooking, or maybe while they're making coffee, between meetings. Try to find these 5 to 10 minute little activity breaks to at least stand up, do some stairs, maybe skip.
While navigating these bodily changes and new reality, it's also important to remember you are not alone.
Don't guilt yourself for what your body has turned into, I would say. It's not your fault.
With COVID-19 vaccinations rolling out increasingly faster in Canada, Normalcy is on the horizon. And emerging from the pandemic, taking control of your health is within reach. Alexia Kapralos, Global News.